Hi everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about coping with the emotional side of knee replacement, rehab, and recovery. So oftentimes the emotional impact, the psychological impact of knee replacement surgery and the rehab and recovery after is overlooked. It's overlooked by individuals going into surgery. It can be overlooked by the healthcare providers who are part of your surgery and your rehab team. We focus on the physical and the functional, but really we have to consider this aspect as well. This can include things like mood swings, anxiety, frustration, feeling isolated, feeling depressed. These are all things that can happen as part of your rehab and recovery after surgery. Just important to start off, you are not alone. This emotional toll is normal. Many people going through a knee replacement go through this as well. So let's talk about what can cause some of these things. So first of all, just general mood swings and frustration. This can be caused by pain, lack of progress with your mobility or your strength. A feeling of dependency on others can lead to mood swings as well. And you can be irritable, you can be sad, and just overall frustrated. You could have anxiety and worry. Worry if you're not progressing well enough, worrying that you may have hit a plateau, worrying that you may be stuck with this pain and these symptoms forever, or just fearing that you may injure the knee and the leg and have to go through all this process with no positive end result. There's also potential feelings of isolation or loneliness. You're less mobile, you're less able to get out and do the things that you enjoy, you're relying more and more on others. So this can lead to loneliness and a feeling of social disconnect. And then we just want to understand that overall mental health can be impacted by a knee replacement. And this can lead to depression, it can lead to lack of motivation, and it can negatively impact your overall recovery from surgery. So what can we do about this? Well, one, we need to acknowledge our feelings. We need to allow ourselves to feel the emotions that we're feeling and not be judgmental of ourselves or others. It's like I said, it's normal to have these emotional challenges as you recover from surgery. We can also incorporate some mindfulness and stress-reducing techniques. Deep breathing, meditation, just being mindful of the emotions and the feelings we're experiencing can really go a long way. We want to set goals for ourselves. We have the big goals at the light at the end of the tunnel, but we also have those small goals. I'm going to walk a little bit further. I'm going to bend my knee a little bit more. I'm just going to get through this physical therapy session or get through this round of exercises that I'm supposed to do for my therapist and for my surgeon. Set those small goals that are achievable and build on those goals as you progress with your rehab and recovery. Having a support system. This may be family, friends, this may be a support group, this may be professional help that you might seek. By having that support, those people you can go to and talk about your feelings, your emotions, and the struggles you may be experiencing. And again, it may be you get to a point where seeking professional help is totally appropriate. Talking about your emotional struggles, talk about your mental health and well-being, and this can really be vital in helping you deal with these emotions and help in the long term progressing with your rehab and recovery after surgery. And it's just important to focus on recovery and not perfection. There's going to be obstacles, there's going to be hurdles along the way. Everyone progresses a little differently along the way in their rehab from surgery, and just understanding that I'm going to get a little bit better each day and one day at a time, and that's all I can do. And just find purpose in your recovery. Talk about, why did I have a knee replacement in the first place? What are my goals? What do I want to get back to doing? How do I want to feel? And focus on trying to achieve those end goals as well. So I hope this helps give you some useful insights, some useful support for those of you who are going through some emotional struggles as you rehab and recover from surgery. Understand that it's completely normal. It happens to a lot of people. I would even say the majority of people at some point in their rehab and recovery deal with some emotional, psychological issues or concerns. And just, focus on some of those tips and feedback understand that, this too will pass. You will continue to rehab and recover, and the majority of folks at the end of the day are happy that they had a knee replacement surgery and have a positive outcome from that surgery. Please be sure to leave your comments and questions below, and thank you for watching.